to mothers in Mandera County. Giving life was the most life-threatening encounter. Health facilities far from them, and even when they got there, safe delivery was not guaranteed. This is the story of women in Takaba, Mandera County.
This case which we have in here now is a mother who had premature rupture of membranes back at home, which is around 40 kilometers from here. There is no network. The husband traveled all that way to come to look for assistance. Then the ambulance went, collected the mother. After a night's sleep, he went on to true labor, and she delivered a premature baby whom we kept on the incubator, which still we did not have, but now we have an incubator, and the baby has benefited from the incubator since the baby is 6 months old.
Namina mumbadiati wan ma korito kon na gogor ani na arbi ani eden wan kana chumar na dawani ana tahbana chigari mudga china fudi ramadawana tadandani bisana dawana kinnan alhamdulillah ma wayari nga dabulaya di kalera ngeza na harqatel man kana kasirratna ragaba.
When the husband came first, he said that the mother has vaginal bleeding. But when the mother came to the hospital, we found that is the premature rupture of the membranes. So the membranes were leaking. So we did an examination. The mother was not in labor, but there was a case of urinary tract infection. So the mother was put on antibiotics and IV fluids and kept on bed rest on the hospital. So it's just after one day the mother went into labor. The second story is about a mother who is around, it's about 100 kilometers from Takaba. They are out of network coverage. Even the health facility on that side is still out of network coverage. So there's no way they could reach the referral hospital. The mother went on labor 3 days ago. So they tried at home, and then they looked for means, their own public means. They brought the mother here today around noon. According to the examination, the mother could not make, there was cephalopelvic disproportion. So the head was bigger than the passage where the baby to pass. So the mother was prepared for the theater, group cross-matching was done, donation of the blood was done, the mother was wheeled to the theater, and she got a live baby. And they are both stable. They are in the postnatal ward.
Lana gaddu fefilem burduras ya chitl man qabatel kallam buleni kalege sagade oninu bayane leni fasti gari ga korre dutana kabasan jawu fatu bese nga korre edu trajiganne artamalle matatu bese nga korre in malle na qabate zaid dibamene al kallam bule Laftillee fagootan keessa gayyaane saa 12 gayyaane saa 10 saa 8 dhufe. Ilmaani narra bahu diddeeta akka keessatti opereeshinii narra gabbaasa. Amma dassumoo dhagaa rabbii galata galchee kan dhibiin hamtuun adda qabu hin jirtu.
Hojjaan Takaba dhufe waan nasiibaa daktarii hin argadhe rabbi galata isaan badiin akka dansaa nu qarqaaranii doktaanii cuftii nu kulmee waan irraa tabartii isaatiif ka beek isaatiif naannoo bira ejjete.
Courtesy of a vigorous campaign to revamp the health sector in Mandera, dubbed M-Care, a ray of hope is evident.
The healthcare sector we inherited was total of 52 health facilities that were the facilities that were available, and out of which only about 10% of the health facilities were operational at less than about 10% capacity. And what we realized, the single largest contributor of maternal death was lack of skilled birth attendants at the hospitals. And we verified this to be the fact on the basis of the fact that we inherited 152 skilled health personnel for the entire county. We increased the health personnel by about 200%. Phase 2 was to make sure now that we had personnel is to get Medicare supplies, in terms of drugs, pharmaceutical and non-pharmaceutical items to these health facilities, which we did and distributed. And within pretty much a period of less than 4 months, we were able to operationalize 100% of all the health facilities that were available. Not only that, but managed to also add an additional 8 health facilities, bringing the total number of health facilities that were operational to 60 health facilities.
Since its renovation, Takaba Health Facility has performed several Caesarean deliveries and handled several complications, saving many lives.
The western part of the county, that's Mandera West, have recorded the highest maternal death due to lack of referral facility within range. We have had most of our referrals done to Moyale, and in process we have lost many lives. To address this, we immediately embarked on operationalizing the theater at Takaba, the former Takaba District Hospital, now the Takaba Referral Hospital. We have successfully posted 2 medical officers and anesthetist and fully equipped the theater.
Currently, we are able to handle emergency cesarean sections. We are also able to do a host of other minor surgeries. So these were services that were initially not available in our facility. Patients used to go to the nearest referral hospital, which is Moyale. We used to lose our patients along the way because of the distance. So I must say that this is one of the big changes that the county government of Mandera has brought to this area.
There before we used to suffer a lot because after we get such a case, we could start looking for a vehicle. The hospital did not have any vehicle, any utility car. So we used to borrow a vehicle from the NGO around. We keep running, but currently we have in our own theater, even if it is at what time, we get a mother with CPD, we get a mother who cannot make it for delivery. We just prepare, we have our own anesthetist, we have our own theater nurse, so we just wheel the mother to the theater and the story ends there.
Rural areas and rural facilities, most of these facilities are not well equipped to offer maternity services because they lack the maternity wing and even they lack the skilled staff to attend to these patients. So this problem can be best addressed by educating the public and also improving on our referral systems, availing ambulances in time. It can also be addressed by addressing the issue of network.
The problem that we have been facing was, for the last 5 years, since this hospital was built, was a chronic shortage of staffing. Imagine this facility with all these services, infrastructure, with only 1 clinical officer for the last 5 years, 4 nurses. With this short period of the county and the county governance, We received 6 clinical officers, 2 doctors, pharmacists, 15 nurses, 2 laboratory technicians, subordinate staff. So we are almost, for us it was like day and night. We 100% support devolution of health services, especially, and we are talking about of experience. This is the real solution, and the best thing Kenyans have done was to go to devolve services, especially health services.
These ladies represent many who are now benefiting from the newly renovated facility. They will otherwise have to travel several miles away seeking for medical services. Takaba Hospital exemplifies many of the successes achieved by the health sector in Mandera County.
If we keep at this pace for the next 5 years, I'm sure we are done. Completely transformed.
We are delighted to celebrate with you today the success of the first Caesarean section done at the Takaba Theatre, and I'd like to congratulate the team behind that and the community for utilizing the service. This service is now available at your doorstep. We invite you to use this service as well.
Mothers who are delivering at home, it's not safe for their life. It's just risking our own life and the life of the baby.